Hello everyone, Dr. Mandell with you. Hope you're having a pleasant day or night. We are actually streaming live. Let's come on off here. I want to say welcome to everyone out there. Today is going to be a very important lecture about the facet joints in the neck. Many millions and millions of people worldwide are having chronic pain, and most of them are coming from these facet joints. Very few physicians, neurosurgeons, neurologists, orthopedists, actually physiatrists, pain doctors, they don't address this particular joint. And I want to show you today why so many of these problems are coming from the facet joints rather than from the discs or on the nerves. Now, most herniated discs are not symptomatic. I can go ahead and take 1,000 MRIs of different people and we'll find a tremendous hundreds of people who have positive MRIs that have normal symptoms. I want to say hello to Chani out there, Claudia, and my chatters out there. I want to say thank you for being here. So let's get to the nuts and bolts, and I think you'll really enjoy this. I'm going to show you a great technique that you can do to help stop neck pain. You're going to hopefully find out that maybe your problem is coming from these facet joints, and we're going to mobilize these facet joints. I'm going to show you what I'm going to do, and you're going to watch me. It's a very simple procedure, but I really want you to understand what is happening here. I'm sure we're going to fill the chat room up. Let's go ahead and let's get busy. I think this is going to be a great lecture. I think you're going to learn a lot of great stuff. Chronic neck pain obviously is something that millions of people have, something that I had going back many years ago, and I still do get flare-ups, and that's a whole nother story, but that's why I know so much about this, because I've done deep in about every corner there is, and I've done so much homework that I want to teach this to the world, and that's why I'm here right now. So we look at this man right here, and we can see that he's holding his neck, and you see that white, you can see those white lines inside of those tissues. Those are adhesions. Adhesions is scar tissue. So what we're going to learn is that we're going to learn from poor posture. When we put our head into a position like this, for long periods of time, the head being 12 pounds for every inch it goes forward, additional 10 pounds of weight. We have excess stress being put upon these joints. And I'll come back to this in just a second, but this is where our problems stem from. Adhesions. Remember, anything you do chronically, it's like surgery. You cut something, you overuse something, the body's going to repair itself with scar tissue, and scar tissue does not have the normal durability like normal collagen tissue has. So if we look at this picture here, you can see forward head posture, see the adhesions start to occur. Primarily, you get it from two things. You get it from poor posture, which is extra wear and tear tugging on the tissues. The body has to repair the damage. It repairs the damage with adhesions, scar tissue, or surgery. Okay, I just had some cleaning out of my knee. He cleaned out something into my knee, the surgeon, because I was a rugged athlete. And when he went in doing the surgery, I developed scar tissue in a different area from the surgery. So he corrected one area and I developed scar tissue in a different area. And I'll get back to that another time, and I can give you advice how to remove scar tissue. There are techniques that we can do that, as well as nutrition. So as we move here, this is a fellow or a young lady here typing, and you can look at the muscles starting to pull and tug. And when those muscles pull and tug, obviously that causes the tissues to microtraumatically tear, and that leads to scar tissue. Now, if we look at this here, this is just some anatomy of the vertebrae, looking at a little bit of the vertebrae. You can come back and look at this later, the front of the body, the anterior part and the posterior part. But let's move up a little further up here. This is something that I want you to study this. This is really important. I'm not going to go into deep anatomy, but you see these spinous processes right here. Now I'm facing it. If I turn it this way, you're not going to see it. But these spinous processes is what you see in the middle of the vertebrae. Take your fingers, put it behind your neck. You feel those bones stick out? Those are called your spinous processes. All right, now that's going to be our landmark for our correction today that we're going to do. So next to these spinous processes, you have the lamina, which is on both sides, and that's what we're going to be contacting. Okay, see where my fingers are on both sides here? So when you go back and touch these bones back here, we're going to be on just off the side of these bones, and we're going to be putting motion in there. That's what we're going to do to help correct that. Now, someone's mentioned, why can't they go at the front of the neck? The front of the neck is the bodies of the vertebrae. Okay, these are the bodies. The curve should be like a C-shaped curve from the side. Okay, these are the bodies, and the bodies of the vertebrae are where the discs are, and where the disc level is, that's where the nerves come out. Okay, but we can't do anything to the front of the vertebrae. We can't get there. We have our trachea or esophagus. We have our carotid arteries. We have our hyoid bone. We have everything go in there. We can't get in there, but we can contact the back part of a vertebrae, and that's our goal today. Okay. So we move up the ladder here. This shows you a little bit more anatomy. Okay, you can look at this on your own time, but you can see how complex it is. And you got the brachial plexus, you have the nerves that come out, you have a significant amount of muscles, you have the brainstem that comes down from here down to the second vertebrae. Okay, right about here, called the axis. So this is something interesting you can look at on your own. So the other thing I want to attribute, and I'll come back to this in a second. There's one thing that we're concerned about. If you look at the title, it's called Stop Neck Pain. It's called Facet Joint Mobilization. Now, what are the facet joints? That's why I want to come back to this picture here. The facet joints are in the back, and I want to show you right here. When you have the vertebrae open up, when they come together again, they sit on each other. These are the facet joints. And in the facet joints, you have the superior and inferior articular facet joint. Let's see if I can come real close in here. And these are where the vertebrae sit on each other. So when your neck moves, guess what's moving? What's moving are the facet joints. So I'm about to teach you something about facet joints. We commonly get scar tissue or adhesions in the facet joints that limit mobility, that cause serious pain, as well as trigger points that can refer to all different parts of the body, down the arm, the chest, the mid-back. It could radiate into the face, the headaches, the eyes, and not necessarily coming from the nerves being compressed by bulging or herniated discs. There are many, many, many great studies out there. I'm not going to go through them, but I am going to touch on something important. But our objective today is to put motion into the vertebrae, to the different segments, to hopefully restore adhesions and scar tissue in the facet joints, because what I want you to see here, all right, let's go to a very important picture, and I'm going to skip around. Let me come back to that. By the way, let's talk about this for a second. That's a facet joint. Now, that facet joint has scar tissue in there, has degeneration, some spondylosis, and obviously when that scar tissue starts to form, as well as inflammation, that can cause significant radiation of pain. Now, you don't see the nerve being pinched there, but this causes the same amount of pain, if not more, than pressure on a nerve. Just to show you one step further, this is a picture here of an epidural. They're putting steroid, obviously, in the facet joint, or you can say this is a facet block. It's similar to an epidural. They're still sticking the needle in there, but just in a different area, sticking steroid in there to help reduce the inflammation there from the nociceptors. And that's a big thing that you're going to learn today, are nociceptors. Let's go to the chart on nociceptors right here. And this nociceptors, as you can read, they're special receptors that respond only to noxious stimuli and generate nerve impulses, which the brain interprets as pain. The facet joints have serious nociceptors, a fibrous capsule. Believe it or not, the annular fibrosis, the disc, as well as the outside of the disc, as well as the meniscus, as well as the articular cartilage, as well as the synovial tissue in there, do not have those types of nociofibers as these facet joints have. So, because these facet joints are so ultra sensitive that when there's any kind of mechanical, thermal change or irritant that occurs in these facet joints, it sends serious impulses from the spinal cord to the brain. The brain interprets it as serious pain that can be significantly chronic, and that pain can radiate to many different areas. So the purpose of this program, this video, is to do a technique, subtle technique, to increase motion in the facet joints to break down adhesions that may change hundreds of thousands of lives by one little simple technique. And the technique is simple, because what we're going to do is to restore movement in the joints from incorrect poor posture that we added this potential fibrous scar tissue or adhesions that no one's ever picked up. Physicians are looking for serious herniated discs, or looking for spinal stenosis, but no one's picking this stuff up. But hopefully this will be something that can help you. So let's get right to it. Okay, let me go back to one of my favorite pictures, right in, let's see, right here. Nope, not that one. Let's see, right here. Okay, now we're going to contact the same side of our neck. And when I do this, let's say this is my neck right here. I'm just going to use these two fingers on the left side, and I'm going to contact right in here. So let's put this down. We're going to contact next to the spinous processes. If we feel down in the lower neck, and I'm going to turn around. That's the center part of my neck. I'm going to start from the lower part of my neck, take these two fingers going just on the left side of those spinous processes. So let me give you a good anatomical chart that you can look at here. Those spinous processes are those thick things sticking out. I'm going to go just on the left side of it. And I like to use like these two fingers. What we're going to do is we're going to contact down on the lower spinous processes off to the left. I'm going to just rotate it and use these fingers as like a counter active type of thing, just a counteractive. I'm just taking it and putting it through light motion, just like this, right? Rotation. Now, so we're going to do this, and then we're going to go a little higher. Good. Okay, so I'm going to contact a little higher. I'm going to turn around and show you. Okay. I start low, work my way up. Okay. Now, when I do that, you're going to hear some little noises in there, some little cracks and crevices. That's the articular facets gliding on each other. So what we do is we start low with the two fingers on the side of that spinous process, and we just put it through little motion. We work our way up the spine. Look at my fingers. Okay. And then we work our way down. And you'll work each side maybe about 30 to 45 seconds, and you go back up. Then we go to the other side. These two fingers on the right side, contact to the right side of the spinous process. Take these two fingers, counteract it. Okay? This is what we're doing. So what we're doing is we're stimulating movement, stretching in those facet joints. And we go back down. Now, you're going to do it subtle, not hard. It should not hurt you. If this technique hurts you or you get radiation of pain while you're doing it, you stop. It's a very subtle procedure. It's not manipulation. It's a nice subtle procedure to increase mobility. But when you get that contact on the vertebrae like this, okay? Okay, I'm coming from behind here, and we're counteracting this. We're stretching it just like this. We're coming around, okay? And we're going up and down the spine on both sides, and we're restoring motion. By restoring motion, we're restoring function. And when we restore function, we're hopefully going to restore health to whatever potentially may be limiting your range of motion. That can be chronically causing those nociceptors in the facet joints to fire. Because when there's something that's inflamed and irritated, those nociceptors fire to the brain. They fire to the brain. They fire to the brain. They just keep firing to the brain. this could last a lifetime because those nociceptors, it's not a nerve. They're sensory. It is an afferent nerve stimulation, but it's not the spinal nerve that's being compressed. These are the afferent sensory nerves on the surface and around on those facet joints that's causing that stimulation, that firing potentially to the brain, as well as referred pain, because when the brain gets messages to something that's inflamed, guess what the brain does? It sends messages back down the spine to different areas. So that's how we get referred pain. The body's a very complex organism. The body's only trying to survive. So just because you get pain in different areas, don't always think that the pain is coming from that area, because most of the time it's not. It's referred from a different region. So I just wanted to bring that out to you to give you education. This is something that most physicians do not talk about, do not even actually understand. For the many years that I've been dealing with this, I learn new things every day. I'm in the studies, I'm in the research, and that's why I'm here. To educate you, because my neck condition that I had, I've been to several neurosurgeons. I've traveled around the country. I've been to several orthopedic surgeons. And guess who helped my condition? Myself. Because I was proactive and I learned and I studied. And that's why I'm here with you, to share this information with you, because I don't want to see anyone out there get anything invasively done if it's not needed, because most of these procedures that these physicians, these surgeons that are doing are not necessary. I'm telling you from experience, as long as you're not getting atrophy wasting away in the muscle, as long as your reflexes are still normal, and as long as your motor strength is still normal, you are not a surgical candidate. Most people jump into surgery because they can't withstand the pain, but unfortunately, the majority of these surgeries are not all successful. Not only are they not successful, but now you have new problems because of scar tissue and adhesions. I really hope that this video gives you a better outlook on life, on health, and on pain. I can really feel your pain because I know what it's like. I know what it's like to suffer, and there's no one that you're going to hear it more truthfully than who you're looking at right now, because that's my mission. My mission is to help not hundreds of thousands, but millions of people out there, because it's education. There's a lot that we can do when we stay proactive. I appreciate all our chatters in our chat room there today. I ask you to share this video and check out my channel, Motivational Doc. I have great self-help videos out there, probably more out there on neck problems, a lot of great stuff in cutting-edge nutrition. Check me out on Facebook, Motivational Doc. If you'd like to leave any comments out there, any reviews on my Facebook, I would appreciate that. And if you have questions, you can address it over there as well. But leave your questions down below, because there'll be many thousands of people reading this and looking at this video. I thought this was quite comprehensive. I apologize for the time, but this is your health, and we cannot put time on health, because your life is the most important and precious. Anyways, God bless to everyone out there, and we'll catch up with you real soon. And wishing blessings to you and your family. Take care. Bye-bye now.